Doing the dengue fever, as everyone says it. So let us see what are the characteristic features which the patient presents with. First is headache, fever, which is of biphasic type or biphasic illness is there, and conjunctival infections, retrobulbar pain, and pain in joints and back. So back pain and joint pain. So these are all what the manifestations of the dengue fever. It has four serotypes. Dengue 1, so what is it is called DN1. So dengue 1, dengue 2, 3 and dengue 4. So there are four serotypes, and it basically causes two kinds of infections or clinical features. First one is the classical dengue fever or dengue fever, and the other one is the hemorrhagic fever, dengue hemorrhagic fever or dengue shock syndrome. Dengue hemorrhagic fever and dengue shock syndrome both are very much dangerous. So this is prevalent in most of the tropic areas like India, Asia, Caribbean, Pacific, and some areas of Western Africa. So in India, it is most prevalent in eastern coast. And in the classical dengue fever, there are manifestations as older children or adults are affected. These take the incubation period is 5 to 8 days, and macupapular rash is present on 4th to 5th day of the fever, and it is febrile illness which takes 10 days before vanishing off. It is rarely fatal. Now let's come to the more dangerous form, which is dengue hemorrhagic fever or dengue shock syndrome. This is common in children in the age of 5 to 10 years, and it appears as hyperimmune response. The hemorrhagic fever or the shock syndrome is very much dangerous, and it is fatal also. Hyperimmune response, it is because it has hyperimmune response in dengue hemorrhagic fever, and it occurs due to when there is a dengue fever once in a life with one serotype, then our body forms antibodies against it. So when another dengue serotype, suppose dengue 2 is coming, then the antibodies will attack to it. These antibodies and antigen will make a complex which is known as virus antibody complex, and this has a symptom of dengue fever initially, with hemorrhagic rash, thrombocytopenia, and mortality rate or the fatal rate is 5 to 10%, and occurs only in endemic forms in Thailand, Asia, Southeast Asia, India, because they have various dengue serotypes present regularly there. Otherwise it doesn't happen generally in other areas like Caribbean or Pacific, where the dengue fever or the dengue serotype, one of the serotype is present. Because these forms are complex, then the virus will not be able to counteract this infection. And for the lab diagnosis, We can take serum for antibody and antigen detection, and for isolation we can take serum or the naturally occurring mosquitoes there. One important thing I didn't tell you, that this comes in arbovirus, and it is due to Aedes aegypti mosquito in India. Aedes aegypti mosquito is the vector or mosquito-borne virus, is the dengue fever, which is in this Aedes aegypti mosquito, and when it bites the human, the virus is transmitted to the blood. So for the antibody and antigen detection, you can take serum, and for the detection of or isolation, you can do the PCR, or you can take serum, plasma, white blood cells, autopsy tissue, and hematological diagnosis. You can check for thrombocytopenia. Thrombocytopenia is decrease in platelets. So if you have a decrease in platelets which is less than 1 lakh cells per microcubes, millimeter cubes, not millimicrocubes, sorry, then it is known as thrombocytopenia. Hemo concentration also increases in this. There is a rise in hematocrit. So detection of antibodies is done by the PCR. You can detect IgM antibodies which are present in the 5 days, and you can also detect IgG antibodies which are present after 10 days of the infection or more. And the most important you should remember is NS1 antigen. This NS1 antigen is also present on the first day of the infection, and only you need 15 minutes for doing this rapid test. Isolation of virus you can do in the live mosquitoes or the mosquito cells which are C6/36 cell lines, or you can do it in the suckling mice. Polymerase chain reaction can be done for clinically diagnosing or by reverse transcriptase polymerase chain reaction. Prophylaxis, there is no vaccine till now, but you can eliminate mosquitoes for eliminating this disease. However, there are trials are going on in which a live attenuated vaccine is going on a trial with all the 4 dengue types. Thanks for watching.